you a little unclear about what it means to be emotionally sensitive? Maybe you've heard terms like emotional sensitivity and empath and highly sensitive person and super feeler, and it's hard to tell any of them apart. Well, in this video, I am here to bust the top 5 myths about emotional sensitivity. And stay tuned till the end because I'm going to address the hot topic of the difference between emotional sensitivity and being a highly sensitive person. My name is Dr. Mary Kate Ruhan. I am a licensed clinical psychologist and drama therapist. Just a quick reminder, this video is for educational purposes only. So if you are really struggling, please reach out to a mental health provider in your state or in your area to get additional support. Let's move into the top 5 myths about emotional sensitivity. The first myth, emotional sensitivity is a weakness. This one really gets me. It is not weak to have emotions. We do live in a society that values reason and logic, and so oftentimes we can feel like there is something wrong with us if we feel our emotions really intensely. A reminder though, people who are emotionally sensitive also tend to be more empathic and more creative and have more fulfilled relationships. So it is not a weakness. I will bust that myth. Number 2. Emotional sensitivity comes from your childhood environment. This is a little trickier, and so I'm going to explain it. It is a myth because emotional sensitivity is not a result of your childhood environment. Emotional sensitivity is a trait that means that you feel your feelings more intensely, more often, and for a longer period of time. And this term, this concept, was developed in the context of Dialectical Behavior Therapy, or DBT for short. And it explains why some of us have a hard time regulating our emotions. Now, childhood environment does potentially play a role in how your emotional sensitivity is expressed. Because if you are someone who feels really intensely, and then you are in an environment where it was unsafe to feel your feelings, or you were told that your feelings are wrong or inappropriate, then you may have developed some unhelpful coping strategies to try to minimize your emotional experience. The emotional sensitivity, the fact that you feel your feelings harder, is a trait. It's part of your temperament. And then the environment that surrounds you can determine how that temperament plays out. So if you experienced a lot of emotional invalidation, yes, you might be more reactive and struggle with regulating your emotions. However, that actual temperament or that trait of emotional sensitivity is something that we see as genetic, something that you were born with. Another myth around emotional sensitivity is that emotionally sensitive people are dramatic. This one is a little bit silly to me for a couple of reasons. First of all, there are 2 ways that emotional sensitivity is expressed. One is emotional reactivity, and one is emotional avoidance. So if you are more emotionally reactive, it means that when you feel your feelings, you're more likely to express them outwardly, feeling really intensely and then reacting. And that could be when someone says, oh wow, they have a dramatic reaction. However, that to me is that person's problem and not the problem of the individual who is just genuinely expressing their emotional response. Another thing is that some of us who are emotionally sensitive actually express this through emotional avoidance. So it means that there is still a tendency to feel really hard and feel more frequently and more intensely. So we still feel a lot. Rather than expressing that feeling outwardly, we will do many different things to try and avoid feeling. So sometimes that looks like using substances, sometimes that looks like distraction, overeating, overexercise. The initial emotional response is there, but we try to repress those feelings as a way of navigating the world as an emotionally sensitive person. Another myth is that you can't really do anything to help someone who's emotionally sensitive. This is definitely not true. Dialectical Behavior Therapy, or DBT for short, is a treatment that was designed specifically to help people who are emotionally sensitive manage their emotions and improve their relationships. There's also many other forms of treatment like acceptance and commitment therapy, or ACT for short, or drama therapy, or EMDR, which stands for eye movement desensitization reprocessing. I know it's a mouthful. So all of these forms of therapy can help people who are emotionally sensitive. And for the big dramatic myth, being an emotionally sensitive person is the exact same thing as being a highly sensitive person. So this isn't really true. Many people who identify as HSPs, or highly sensitive people, likely also possess the trait of emotional sensitivity. HSP, or highly sensitive person, is a term or a construct that encompasses multiple types of sensitivity. So it's not just sensitivity to emotion, but it's also sensory sensitivities. You might be sensitive to light or sound. When we're talking about emotional sensitivity, we're really honing in on people who have the tendency to react more intensely with their emotions, to feel harder, and they may or may not have other sensitivities. All right, myths busted. Subscribe to my channel for more resources on navigating life as an emotionally sensitive person.